This episode is proudly brought to you by the TPG Telecom Foundation, dedicated to creating opportunities to improve the health, well-being and education of Australian communities in need. Hi, I'm Megan Gilmore, Missing School co-founder and CEO, and this is Live and Learn. This is the podcast that unearths insights at the intersection of health and education, building a powerful alliance to keep kids with complex health conditions connected to school from anywhere. The podcast is recorded on Ngunnawal land, and we acknowledge and pay respect to the traditional owners of this land and the land on which you're listening. Welcome to our weekly webcast, a place to zero in on the interplay between health and education and to amplify the voices of those supporting school students to navigate their educational journeys despite complex health challenges. And today on Live and Learn, we have Roxanne Perry. Roxanne is the Kidney Health Manager at Kidney Health Australia, leading clinical projects and programs focused on early detection of chronic kidney disease, education and support for people living with kidney disease. A paediatric nurse by background, she was nurse unit manager at the renal unit at the Adelaide Women's and Children's Hospital from 2001 to 2011, where she focused on educating patients, families and health professionals. Roxanne later held various roles in the dialysis industry until 2023 and completed an MBA during this time. Welcome, Roxanne. We're excited to have you on Live and Learn today.
Thanks, Megan. It's good to be here.
So today we're here to talk about supporting school connections for students with complex medical and or mental health conditions. So let's head straight into the first question.
Right.
Roxanne, tell us how kidney disease impacts kids and why it's something every Australian needs to know and care about.
Sure. So chronic kidney disease is permanent reduction in kidney function that leads to the kidneys not able to filter the blood and provide all the other things that they do in the body. So you get an increased fluid and waste buildup in your body. So in kids, this is really uncommon, but there still are over 400 children out there currently that are on dialysis. So when you get to the point where your kidneys fail completely, you need to have dialysis treatment or a kidney transplant. Mm-hmm. So kids with kidney disease face really unique challenges that are different to adults because it really impacts their life and their development. So interrupts growth, interrupts their ability to get education, their peer support and their social skills.
Mm-hmm. Well, that certainly is something that every Australian needs to know and care about. And that number 400, that's for Australia?
Yeah, that's just for Australia. So there are quite a few kids out there that's under the age of 18 currently, as of at the end of 2023.
Yeah.
So there could be more, or it's not. It seems to be the numbers are about the same.
Mm-hmm. Thanks for qualifying that. So many people probably assume things about kidney disease. What's the $1 million question you get from parents or loved ones when their child is diagnosed with or experiences the effects of kidney disease?
Yeah, so kidney disease doesn't have any symptoms until you get to that kidney failure stage. So a lot of people are shocked when they find out their child has kidney disease because there hasn't been necessarily any symptoms until they are quite sick. So if you can get it early, though, it can be managed really well in the early stages. So finding it early and getting treatment is really key as well.
That's really disconcerting to know that there's not really those symptoms coming forward for a long time, and it could just sort of feel like it happens out of the blue.
Yeah, that's quite commonly what we see. Unless, of course, a lot of about 35% to 40% of kids with kidney failure have got urological abnormalities. So they might be born with something that's affected their kidneys. So for those ones, they do know and that's monitored really well. But for the other types of kidney disease, it can come as a bit of a surprise.
Mm-hmm. And what do parents ask, or what's their biggest question at that moment?
How do we fix it? Yeah.
of
What do we
course.
do now? Yeah. What do we do now? Yeah.
Yeah. And what's the most important thing that you want them to know at that moment?
So it's really important with kids with kidney disease that they try and live as normally as they can, depending on their symptoms. So there are lot of medical interventions. So it's really important to follow the medical advice, medication, and all those things. But it is really important that you give your child the opportunity to get some peer support and to socialize with other kids all throughout their disease process. That's really
Mm.
important.
Yeah, and we'll get into that in more depth a bit later in our discussion. Um, well, knowing all that you know, um, what's your biggest hope for kids with kidney disease, their families and loved ones when navigating it?
Um, I hope that I think it's really important for parents and teachers and anyone that's involved with these kids to find out what the kid is good at and what they like to do. And it's really important to try and foster that. Um, so it gives them a sense of purpose and achievement. So, some kids will like art, and some kids will like music, and some children will like being active. So try and find ways that you can really help your child to achieve those things. And they might not be able to play a competitive sport, but they could do some activity like dance or something like that if there's some physical things that are barriers to them doing those things. So find out what your child likes to do and just really focus on that and get them to do it. And for parents and families, get as much support as you possibly can. Keep asking questions, keep advocating. If you get a roadblock, just keep asking, trying to find a way around it,
Mm.
because that's really important.
Yeah, great advice for advocates, and also that very
Mhm.
critical element, which is to not see these kids as patients, but as kids.
Yeah, yeah,
Yeah,
that's right. Yeah.
yeah,
And every child, as you know, every child is individual, and everyone has the things that they're good at, the things they like, and they're the things you really need to foster in all children, but especially kids with chronic disease.
yeah, quality of life. And
Mm.
if you're willing, we'd love to know what brought you into the world of kidney disease.
Yeah, so I had been working in pediatrics for a while, and I really enjoyed working with families and children with chronic diseases because you get a real connection with them and you get to go on a journey with them and you're able to support them through all the different things that happen to them. So it's that connection. And kidneys are really fascinating. They're such exciting organs. We don't realize that they do so many things. Not only do they make you produce wee, so that's really exciting in itself. But they also, look after your bones, they look after your blood pressure, they control your hormone levels. So they have multiple effects on your body, and they really are the forgotten organ. Everyone, talks about your heart and your brain, your lungs, and all those things that we see here all the time. But the kidneys are in there working really hard, and they're they can actually repair themselves really well. They actually manage themselves.
Wow.
Like if you get some kidney damage for some reason, they respond really well and they can heal themselves and look after themselves. So, they are really amazing little organs.
Yeah, I love that you have this excitement and fascination about kidneys, and obviously that's had played an important part of why you're in the work that you're doing, and
Mm.
almost being that advocate for such a vital organ. Absolutely vital. We know this, but you're right. It's sort of um, the quiet organs, I suppose.
Yeah.
And I've learned something which I didn't realize. I knew that, that the liver is often, people often talk about the liver repairing itself, but I wasn't aware that kidneys have the same characteristic, and that's super exciting, isn't it?
Yeah, yeah, it's great. So,
Yeah.
for example, with a kidney transplant, sometimes when the kidney gets put into, from one person to the other, they sort of, we used to say they go to sleep, some of the little nephrons, but then they can heal themselves and they can wake up and start producing urine and start working. So yeah, it's
So
fascinating.
yeah,
Yeah.
and spectacular. Yeah, I had
Yeah.
I had a front row seat to all vitals when my son went through his medical crisis in 2010 and had a bone marrow transplant, and all of that that treatment obviously affects all organs, and but yes, you do tend to come to respect each organ and its critical and vital role. And also just the absolute incredible machinery of the body is, and the way that it alerts us to something that's not right or not going well. Sometimes
Yeah.
even before, you know, an instrument, a human-made instrument can detect. So, yeah, thank you so
Yeah.
much for that shout out for kidneys.
No, it's all right. No problems. Yeah, they're really cool. They're really cool. Kidney beans.
Yeah. So what are the common and perhaps frustrating public misconceptions about, kidney failure or kidney disease, and how have you seen this impact families, particularly kids?
Yeah, so probably the biggest thing that we see in children that go to kidney failure and need treatment for that is that a lot of people think that kidney transplant is a cure for kidney disease. And unfortunately, it's not. It's just another form of treatment. So if you think of kidney transplant as another form of treatment, it still has a whole lot of things that go with it. So medication that has to be taken every day for the rest of your life. Um, and ongoing care, you still have to go to appointments, you can still get complications. And unfortunately for children with kidney disease, they may need another transplant later on in their lifetime. So kidney transplants don't necessarily always last forever. There are stories that patients have the same kidney for 25, 30 years. And we hope that's for every person that gets a transplant, that they get as maximum as they can. But in reality, the average transplant, it's around 10 to 15 years. So if you have a transplant when you're 5 or 6, then, when you get into your 20s or 30s, you may need to go back on dialysis and have another kidney transplant. So
Yeah.
that is a really common misconception, that people think that a transplant is a cure.
Yeah, I would put myself in that category of people with a misconception that's now been corrected. Thank you. And just, also that shout out for that life-saving opportunity of a transplant, an organ transplant. And also, just as you said, that and I did not realize that it is just another form of treatment. And the person may need to have another transplant at a future time. But also, importantly, as you point out, that ongoing medication, that I guess would include, anti-rejection medications in terms of the transplant. But really important to know, and especially for the community, but teachers and people in schools to understand that, whilst the celebration of a transplant there and not needing now to go to dialysis, as off or well, at all or often as it previously was, is not the end of the story in terms of how that young person is experiencing their health situation.
Yeah, that's right. And, the transplant, the anti-rejection medication brings with it a lot of side effects. Most commonly, it's the increased risk of infection. So that is always a risk as well, that, if there's something going around school, it's really important to let the family of the child with the transplant know that, that there's, rotavirus, or there's a lot of gastro going around, or there is, the flu, I've had kids with the flu or whooping cough and all those nasty things. It's really important that the exposure to that is limited. So
yes, those drugs are immune suppressant drugs to stop that rejection, and obviously it's having that side effect of making children more susceptible to those risks of communicable diseases in school and going around. So and we'll get into that a little bit more about what that means for school.
Yeah.
Roxanne, how many Australian kids or young people are living with kidney disease right now?
Yeah, so the amount of children in Australia that get kidney failure, we have really good information on that. And it's around 9 children per million. So it is fairly uncommon. It's not one of the most common childhood diseases. Currently in Australia, we know that there are about 400 children who are either on dialysis or have an active kidney transplant. The kids with chronic kidney disease, though, that haven't reached failure, because the kidney disease comes in a lot of stages, from stage 1 right through to stage 5, and that stage 5 is when you need renal replacement therapy or dialysis transplant. There's no real database of those children, or even adults, in fact, in Australia that have those different stages. So we don't really have a good idea of the numbers of those, but there would be, it'd probably be in its thousands across Australia that children are being managed for chronic kidney disease.
That's really interesting. And is that because there's no collection of that data, or is it because you only work out that you were at a stage when you've reached a certain critical point? I mean, is some of it just that it's not detected yet, or is it that it's there and being actively treated but isn't being counted?
Yeah, it's a little bit of both. So a lot of early kidney disease is managed in primary care, which is your GP. And so it's not a reportable disease. So there's no Australian data point that people have to put in to say, I've just diagnosed this patient with kidney disease. So that's a bit of a gap in our knowledge of how much kidney disease we know. We know the prevalence from the wider population from the Australian Health Survey for 18 and over, because and that is that there's 2.7 million Australians with kidney disease between that
over 18,
but only 2.2 million of them know they've got it. And so that's the other problem, is that because there's no symptoms, people can be walking around without knowing they have kidney failure or kidney damage and kidney disease. So, and it's the same with children.
So that's a bit shocking. So there's no registry
of chronic kidney disease as such. Yeah.
Yeah.
So there are some data points, but there isn't a national registry. But there is a really good registry for once people get onto dialysis. We have fantastic data, and probably, our database in Australia and New Zealand is world renowned to be really, really accurate. So once kids are on that registry as having kidney failure, which is stage 5, then we keep a really good record of what happens to them from there.
Yeah, it seems logical that a registry of people who are heading towards failure would be a helpful thing, but I'll just leave that there.
But 2.7 million. So there's more people walking around with kidney disease than there are with diabetes. So when you think about that, that's actually quite confounding.
Yeah, it really
but
is.
No one thinks about it. It's one of those, it's the hidden disease. Like I said, there's no symptoms. So it's not as though you can go to your doctor. We know who's at risk, and we know the people that are more likely to get it. So people with diabetes, high blood pressure, family histories, heart disease, people who are obese, people who smoke, First Nations people are at a higher risk as well. So we know that those people need to be checked regularly, and that's our message at Kidney Health Australia. But there isn't good data on how many of those people are getting tested and then diagnosed until they get to the later stages.
Until crisis point.
Yeah, so we're working with that's one of our messages. Kidney Health Australia is trying to work out how we do that. How would that work? What would that look like?
Yes,
but it would have to be a national thing.
Definitely. And when we're talking about school, as we'll get to in a moment, those under 18s, because of and I won't preempt our conversation in a moment, but just because of, as you pointed out at the beginning, the impact that it can have on young people, and those sort of particular cohort of people with kidney disease with specific needs. So I think you've answered this, but let's ask this question just for completeness. Is there a risk of delayed diagnosis, or are most cases picked up easily?
Yeah. So with kids, if you have a genetic cause or something that is, a urological abnormality, one of the most common ones is called reflux nephropathy, where you have the tube that drains from your kidney to your bladder is malfunctions and the urine comes back up into the kidneys. So that's one of the most common things for children. But there are a lot of glomerular diseases, so diseases inside the kidney that affect children as well. So that's the second most common, and that can be presented as blood in the urine. So if it's visible blood, of course, that's quite concerning. But if it's microscopic blood, it might get picked up on as a urine sample done for something else. You know, yeah, so there are some children that don't get picked up. High blood pressure, for example, can be a sign in children, an early sign of something going wrong. So, but
build up
how
of fluid
often,
in the body.
Yeah, build up of fluid, puffiness, but they're late stage symptoms. So, you know, we don't screen, we don't, how long, you know, if you've got children out there, have they ever had their blood pressure checked? Probably not, unless you've gone to hospital for something and then they'll get it checked. So sometimes it's routine screening or just you know, an accidental finding for when they've gone to a doctor or presented to a hospital for something else that you might pick up those symptoms.
What about you know, urinary tract infections that are reoccurring or something? Would that be a
that's one of the signs of reflux nephropathy is recurrent urinary tract infections. You know, a urinary tract infection doesn't mean you've got kidney failure, and it is quite common in children, but especially girls. If it's recurring, so more than three or four episodes, then they will investigate for that. And there are if you've got a family history. So, you know, if you know that there's a family history of kidney disease, there is genetic testing you can be done now that we can identify some specific genetic conditions, and that's becoming more and more advanced as well.
Yes,
so
thankfully.
In families, so your polycystic kidney disease is one common one that we hear of. Alport syndrome is another one. So there are a few genetic disease processes that affect your kidneys.
Wow. Okay, learning more every step of the way here.
Yeah.
What kind of complications do kids with kidney disease face? And this doesn't have to be just physical.
Yeah. So I suppose the biggest thing to think about is that there might, like I said, there's no signs. So there won't be something physically that will highlight to you that someone's got kidney failure. Okay, so that's a little bit different to a lot of other disease processes. But they will get delayed growth and development at times, depending on where they are in their treatment. Sometimes they can have cognitive impairment if there's, you know, issues with a genetic type disease. Emotional and behavioural disorders because they've had a lot of medical interventions. So, you know, kids with kidney disease have to go through a lot of tests and procedures. It's a very medical intervention heavy disease. So there's always tests and, you know, needles and injections and treatments that a normal kid wouldn't normally experience. So that comes with that, some medical trauma and some behavioural things that go around with that and being afraid. They have sometimes strict diet and fluid restrictions as well, depending on if they're on dialysis. They might not be able to, if they don't do any wee at all, some kids don't, then they might not be able to drink very much in a day. If they have a lot of wee, which some kids do as well, they might have to drink extra. If you had a transplant, you need to keep really hydrated. So things like diet and fluid restrictions and guidelines. They have difficulty navigating normal milestones. So it's really important because they do have a lot of time when they're hospitalised. And if you're in hospital, then you're not up and around. If you're feeling unwell and you've got symptoms, you're not doing those normal milestones, you're not moving around, you're not getting those social interactions. So there are those sort of things as well. And it's mainly their mental health can be quite affected because they don't build relationships. They miss a lot of school. They are in hospital a lot. They have separation anxiety sometimes because they don't want to be away from their parents. So there's a lot of different things, but physically you might not even know. There's nothing that stands out. Yeah.
Right. That's super useful to know. And I suppose I guess another question I have there is is there a likelihood that they might have a different physical appearance or is that not part of the picture?
Not really. Sometimes their growth will be delayed, so they might be a bit shorter than other kids, depending on when they've started dialysis. So starting dialysis under the age of 5, you might have some growth slowing. They might not be they might be underweight if they're on dialysis. But then if they've had a transplant, some of those medications can cause weight gain. So they have a high doses of steroids initially, so they can get a really round face. So
Yeah, that's what
sometimes
I
you'll
was
see,
picturing.
yeah, but that's only for kids that have had a transplant. If they're on dialysis, if there's 2 types of dialysis, there's hemodialysis, which is where you take the blood out of the body and put it through a machine and filter the blood. And there's another type is called peritoneal dialysis, where you put fluid into their tummy. But both of those need access, so they need a catheter to help them provide that treatment. So if you've got hemodialysis, they might have a central venous catheter or a central line, which might be up here somewhere, poking out of their neck or out of their chest. And if they're on peritoneal dialysis, they'll have a catheter in their stomach that is a tube that connects up to their machine that changes the fluid. If they've had a kidney transplant, then they'll have the kidneys actually they're implanted at the front in the tummy area, not in the back where your kidneys are, because that's another misconception. You think that they take the kidneys are around in your back here, but the kidney transplant sits in the front on their tummy. So they'll have to be really careful not to bang that, or they'll maybe have a scar there. And sometimes if they want to do physical activities, they need to have a little guard, a kidney guard that they pop on before they do it.
Wow. I would love to go down the rabbit hole of why that transplant takes place that way, but I don't think the audience is probably going to be as interested in that. Well, possibly, I can't assume.
You can,
but
if you have a look, and there's plenty of information on our website. We have a lot of resources, so there are some pictures and some diagrams and things in our website, about kidney transplant. So if you want to delve into it more deeply, have a look on there.
Thank you. That's great advice. Yeah, that's really, really important to know and understand. And there is some circumstances where children may look slightly different, but otherwise, I think we can say that kidney disease may be an invisible illness in many ways.
Pretty much, yeah, it is, yeah, definitely. And that's, and a lot of the kids will talk about that no one really understands, because no one knows why I keep missing school, and why I have to go to appointments all the time. And
and all of those things, like dialysis is taking place outside of the vision of anybody else. So you're just you're there, and then you're not there, and then you're back again. And so nobody's really seeing the impact physically, or that child's experience, which is obviously different to other children, even other children with chronic conditions. So super interesting and just another reason why it's so important for us to have these conversations and share this information, so that we become more aware and understand more about the children we're supporting, but also so that educators out there and school staff and other families understand more too. So this leads me to the next question, which is, how are siblings and peers of kids with kidney disease or failure impacted, if that's a part of your work, and what should families be across?
Yeah, so it's really tricky, like you said. Like if they're on hemodialysis, for example, one day they'll be at school, the next day they won't. And as we know, it's always hard for kids to come back in. So most kids dialyze 3 days a week, and they'll have to go into a hospital centre to do that on hemodialysis. So they'll probably be gone for either the morning or the afternoon, and sometimes all day. Peritoneal dialysis, on the other hand, is done at home, but it's done every night, mainly overnight for children. So they might be really tired, or they might have gone on late because they had a school function, so they couldn't go on. And they normally have to do 10 to 12 hours of dialysis a night. So if you've got a school play or something that's on, and they're not getting home till 8 o'clock, they might be late to school the next morning because they have to finish their dialysis before they can come to school. And they have alarms, and there's things that wake them up in the night. And So they might be tired. Fatigue is a really common symptom for kids with kidney disease, especially on dialysis. They get really tired really quickly
Yeah.
because it is quite an invasive procedure, medical procedure. So that's really important.
Yeah.
So for peers, they're coming and going all the time. So we do find our kids will say that their friends from primary school understand them better than their friends from high school. And
Wow.
I think that's quite common across chronic disease processes, because high school becomes a little bit more autonomous, but at primary school, it's a little bit more supportive in those friendships and groups.
It's an important point.
Yeah. So it is a bit, high school is a little bit harder for everyone, I think, whether you've got a chronic disease or not, in
Yeah.
peer support and peer groups. But there are a lot of changes. So there's lots of ups and downs. So that's really important for siblings and peers. The siblings sometimes find that it's hard for them to get the things that they need from their parents, because it is such a the medical intervention in kids with kidney disease is quite a lot of work for parents. Lots of appointments with different people, lots of last minute things, infections. If you've got a kidney transplant and you all of a sudden have some signs of rejection, you might have to go into hospital for a few days and get
Yeah.
that sorted out. You could get an infection that makes you really sick. If the sibling has got an infection, they might have to stay away from the transplanted child and go to grandma's house for a little while.
Yeah. And even away
So,
from the parent who's
and
caring for that child. So
that's
that,
correct. Yeah.
yeah,
So there
that's
are a
really
lot of
hard.
so at Kidney Health Australia, we do kidney escaper events, and these are for families and children that have kidney disease, and that include the siblings, because it is really important for the other siblings to be able to talk to other siblings of children that have kidney
Mm.
disease. So for many years, I was involved in Kidney Kids Camp, which is a national camp that was held for all the kidney kids to come together nationally, because there's not many of them. There's only sort of, 400 that we know of across Australia. And so for them to come together and meet other children with kidney disease and get some peer support that way. So we also invited the siblings, and they found that just as useful. I heard some beautiful conversations between different siblings about how their experience and the things they hated and the things that they liked, and how they loved their brother or sister. But it is makes the relationship a little bit more complex. As we know, with any
Mm.
siblings with children with chronic disease, it can be a burden on them, because they feel guilty, because they might want attention, and all kids want attention.
Yeah. Yeah.
But they know their parents are busy looking after the child that is unwell. And so it is a balance of making sure that the siblings are supported, and also that that the peers, the friends of these kids that are coming and going all the time, understand what's happening, and can be part of that journey as well.
Yes. Thank you for that. And just noting that guilt there for siblings. Yeah, the guilt can be around feeling like a burden or asking for things. It can also be around um, the fact that they don't have the disease, and the fact that they get
Yeah,
to
that they're
do,
well.
yeah, that they're well, they get to go to
Yeah.
school, they get to go out, they get to play the
Mm.
sports they want, or all of those other things. This was a point that my daughter's, the sibling, the sister, obviously, of my son who was unwell, um, shared this point recently in a revelation to me, even after all of the years of my work, was that, if we could make school better for kids with chronic conditions, then it would relieve the guilt that siblings feel in the
Mm.
differential experience and opportunities that they get, and their sibling who's has a chronic condition doesn't get. So they're
Mm.
carrying that as well. It's not just for being, in some cases, the well child, but also the child that's getting to do the things.
Yeah,
Um,
and they also sometimes have a care burden as well, which we mustn't forget
absolutely.
about. Especially at school, if they're both at school together and mum and dad aren't there, a lot of times you'll call on the sibling if there's something that
Yeah.
that the child
Yeah.
might need, or they feel responsible, so they go and check on them at lunchtime, or they go and
Yes.
help them with their lunch, or they help them with this getting changed to their sports uniform. And there are a lot of things that they do that they
Mm.
become a carer. For their sibling. And even in hospital, you see that as well, sitting, playing with them on dialysis. And
That's right.
and all those sort of things. So you
That's right.
can't really underestimate that caring role that they do.
Mm.
And it is, it is really valuable to recognize them for doing that
Yeah,
caring role
and to
and
that,
thank them and make sure
that's
they
right.
feel appreciated. Yeah.
Yes, that is absolutely right. And that care can even extend at times to enabling parents to be able to go to work. So
Yeah,
it gets
absolutely.
quite complex.
Mm.
Yeah, a big shout out to siblings of kids with chronic conditions.
Yeah,
Um, do you know
definitely.
what the current population of school-age children with kidney disease is? I think you've answered this, but
Yeah.
again, for
So,
completeness.
well, I've looked on so like I said before, I've got the data from the kids on dialysis and transplant. So at the end of 2023, which was the last release of data, so it always comes sort of a year or so later, there were 10 children in Australia from 0 to 4. There were 17 between 5 and 14. And there were 60 between the ages of 15 and 24. Now, we do go to 24 because we actually count them as youth. Because getting diagnosed with kidney disease, even when you're 18, 19, 20, it still has a whole different way of, it affects you a lot differently because you'd be at
Mm,
university, you still be part of an education system normally at that age as well.
yeah. And I noticed there that the numbers are increasing in those age brackets as well.
That's right.
Yeah.
So when, if you are born with something and you're managed really well, it might not be till your teen years that
Mm,
you end up needing dialysis.
yeah.
Um, yeah.
Do kids with kidney disease currently miss a lot of school, and why? I think you've answered
Yeah,
this
they do.
already.
I probably have. I probably have. But some of the data we've collected shows that amongst those 12 years or older, modified schooling is really, there's a higher percentage of those children needing modified schooling.
Mm,
So that means either they're doing part-time school, they actually need some special needs in class. And some families even put their children into homeschooling because they find that it's a little bit easier to maintain their educational needs
yeah,
without having to go somewhere to do it.
yeah. And
Um,
maybe that protective factor as well is coming into it for families is just school as a
yeah,
petri dish of community.
acquired infections.
Yeah.
Yes, it is. Yeah, absolutely. um,
um,
but yeah, it is definitely, and it is isolating. So it can be isolating because you can't sometimes
mm,
participate in normal activities.
mm, yes.
So it's very, and lots of appointments. Aside from dialysis, lots of doctor's appointments. They might need appointments with a dietitian, a physio,
Yeah.
a psychologist, a social worker.
Mm,
They might have to have x-rays and scans and blood tests and
yeah.
all those sort of things they have to fit around. And unfortunately, if you think about it, what time do most health services open? Between 9 and 5. So, there's school
Exactly.
hours. They're not necessarily open after hours or
Exactly.
yeah.
Yes. I used to train timetable for after school, and um this was post my son's bone marrow transplant and him being back at school and everything. And yeah, the hospital used to get quite cross because I was trying to schedule outside of when they wanted it, but I was trying to protect that precious time at
Mhm.
school when so much of it had been missed as well, and not just for academics, but also that social aspect that you mentioned that's so important to
Mm.
these kids, and the feeling of being normal. Um, and
Yeah.
we talk about high school not standing out, not being the one that's coming in and out, like all these different things that play a role. And I suppose puberty and the hormonal changes would have different kinds of impacts for these kids as well. Um,
Mm,
as
definitely.
as
Yeah.
as maybe not complicating factors physically, I don't know, but certainly socially, it's always
Yeah.
a torrid time.
Socially and growth and changing doses. So, with the dosing for potentially
Mm.
for medications, as you grow, you might need more dosing. So there can be times when things, especially in adolescence, when you're having these big growth spurts, that medications need to be adjusted frequently, which means more
Mm.
monitoring, which means more appointments
Yeah.
to do blood tests and blood levels and all sorts of things like that. So
Yeah, yeah. And this is probably the moment where I always plug in the work that Missing School's doing, and in terms of those absences, which are clearly recurring, and also, long stints too at times, or even absences as a protective factor when there's viruses raging in the school environment. To maintain learn from anywhere, so two-way digital connection into the classroom for these kids, so that they can dial in when they're when they're on dialysis, or when they are having times at home, to be able to join their classes through two-way digital connection alongside their peers, and continue learning. Remember that thing called COVID, where overnight schools went online with ubiquitous video conferencing technologies that we use every day now, and even in work environments. And of course, you and I are here using this technology for our conversation. So from Missing School's point of view, we've been using telepresence robots to do this, but really what we want is to get schools to a place where this flexibility is business as usual in schools, and built in for kids like the kids we're talking about, to just simply be able to join when they can, and not miss school, to be able to be present and in the classroom. So that's our big goal, and it's why it's part of the reason why we're having these conversations with people like you and your organization, is to hopefully build a national consensus around something that we know is so easy to do. If a tiny charity can do it and make that proof point, then certainly our education systems can do it with their large IT areas and all of their resources and capabilities. And I recall actually very early on in our work in placing telepresence robots, was a student on dialysis who was waiting for transplant, and it was an incredible find for his family, to think that he could keep joining class from from clinic or anywhere else. And he went on to have a transplant, and didn't need the robot anymore. So was back at school. So it was just a proof point that I can bring in there, specific to our conversation as well.
Yeah.
So what are the critical times in school life, if we haven't covered them? And what should families and schools be prepared for at those times?
So adolescence is a critical time. Transition to high school, changing those peer connections, making sure there's still access, not standing out. Modified school is another critical time. So if kids are on dialysis, like, you can set up processes, because it's fairly routine. So if they're on hemodialysis, like you said, you use the robot. That's great. You knew when that kid was at dialysis, so you could link them in. But then, if you're on a transplant waiting list, you get a transplant in the middle of the night, and it just, everything has to stop because you have to go into the transplant. And it's 3 months really before after transplant before you can be back to any sort of routine or attending school. So those big chunks of time are another risk when they're immunosuppressed, for missing school. And so having the opportunity to have those links in during those times as much as you can would be really good. We know probably the biggest risk time for all kids that are on, especially those with transplant, is transitioning from pediatric care to adult care, which is part of that journey that they do in transition. So there's a high risk of non-adherence. So in the later adolescent years, there's a high risk of non-adherence because, like you said, peer pressure, you want to be like everyone else. There's parties, there's alcohol that comes into it. There's all those risk factors.
No, says the kidneys. No.
Yes, no, none of that for the kidneys. Complex kidney transplant compliance regimes. They have to take their medications at a certain time. They're 12 hours apart, so 8 and 8 or 9 and 9, and all of a sudden the kids are sleeping until midday. The you have to,
Doing
there's
what
all
kids
those
do.
doing what kids do. So all of those things make a big difference. So yeah, they're the risk factor times
And
for
schools
kids.
have to play a role in that. There's
I think
really
so,
no
yeah.
choice, is there? Well, I suppose
No.
there is a choice, but kind of not. It's a life-saving
Yeah, and it's about
measures.
the risk management
Mm,
and communicating with the families and making sure
yeah,
that everyone knows what's happening and
yeah. So
picking up behaviours and
that's right. And even harder when illnesses or diseases are invisible, as we mentioned earlier,
mm,
because that isn't creating a pressure point, and especially where kids would be interested in hiding even symptoms. And I've heard that in the teenage years, even, you know, incredibly detrimentally in cancer settings where they won't admit to things. So yeah, it'd be hard for schools to pick up on those things if that circumstance is going on. Things that the school can do that we plug in here, and you mentioned, you know, the adjustments or the flexible schooling situation, is that kids with chronic kidney disease or kidney failure or post-transplant are absolutely covered by the disability standards for education. It's a very broad national regulation that sits under the Anti-Discrimination Act and provides schools with the levers to that's every single school, regardless of state or territory or school system, the standards apply to, and enable access to classrooms, learning alongside peers, assistive devices, including telepresence, which we talked about, access to the national curriculum and to additional supports in schools. And importantly, when the disability standards for education are understood and applied to a student with a chronic health condition, the school can also get funding through national funding mechanisms to enable those additional supports that the school needs to implement. So it's really important for families to know this and to know that being able to have an individual learning plan through that standard is absolutely available. And of course, you know, as we've talked about, something really important in the school too is also that health plan and health and safety plan in school. And I like to call these plans something that we really hope to see is portable plans, that plan goes with the student wherever they are, in whatever place of care they are, whether it's at home or in clinic or hospital, and of course at school, that plan can apply so that they're not missing their equal opportunity to an education, social connection, and support that they need and are entitled to. So that's the plug for the disability standards for education.
great, yeah.
School life challenges as we come to the end of the conversation here.
Mm,
You've covered off what the biggest challenges and vulnerabilities are really, really beautifully for us.
mm.
Is there anything that you hear from families now or observe yourself in terms of what schools are doing to support students with kidney disease, failure, or post-transplant? And do you see any areas for improvement in that?
Yeah. So I think let's remember the medical burden of kidney disease is the greatest issue for these kids. There's a lot of medical burden.
Mm.
I've got some quotes for some kids with kidney disease that I'd like to share, if
Please.
that's okay. Yeah.
Yes,
So
please.
some of the quotes are, we did a an investigation in 2018. We did a big report about kids and youth and what they needed for the national government. So with kidney disease. So one of the ones was, it's definitely hard to keep friends when you're sick. I've lost so many friends because they just go and play with someone else when I'm not there. Another one, we were learning about multiplications, and it was okay. I didn't I didn't have to learn it because I had learnt it before, but I was more bummed that I didn't have that connection with friends. I wasn't in a group. So I went back to school and I wasn't in a group, and everyone else had already formed groups. It's really hard going into classes when you don't know anyone and there's no one in your class that you know, particularly for high school. It's a lot of kids find that really difficult if you're in a class with complete strangers. I missed half the grade, so I didn't get what all the other kids got. I wasn't in a group. I wasn't in a group of friends because I missed the first half of the year. So so they're just some of the things that, and for the families and for the parents, it's about no one really understands, and I lose a lot of social connections because no one really gets it, because it's not something, unless you've experienced it, that you understand. So that's really important.
And
one of the biggest challenges is kids with CKD don't necessarily get access to any support. They're not eligible for NDSS. And then they don't. Some parents aren't eligible for carers payment, depending on where they are in their financial life and what their situation is. So
we have
that's a
disease
real
burden
issue.
with financial burden.
Financial burden as well.
Proportionate to disease burden.
That's right. And the financial burden is really high for kidney disease.
And this NDIS, I mean, it's so complicated right at the moment in terms of even students that NDIS recognises and supports, or children, I should say. But that is such a critical point because it affects the whole of a family's life. And I think this is what we've tried to capture through our questions and your answers here today is, the effects are not just siloed into an education question. No, they cover the whole gambit of family life, and that includes financial effects. So, and we see, and I'm interested in your observation on this too, is the disproportionate impact on women and mothers in this setting in terms of care work, either through the disease itself and treatment, but also through trying to maintain that education. Is that your observation in this setting as well?
Yeah, I think that most of the carers are mums. Occasionally you have dads or grandparents, and you have really good supportive families, but other families, not so much. But there are significant financial challenges because there is a lot of time need to be taken off work to take your child to medical appointments. So more commonly, the mother will be the main carer and potentially maybe not work just for those reasons, especially if the child's on dialysis. So that is an issue, and not being financially supported.
You're saying that some people don't qualify for carers payments, so they're having this double whammy of increased costs due to medical burden or care or treatment, and at the same time work is affected, and that is disproportionately affecting women, mothers, and that's quite a complex mix there.
And I think that comes with any chronic disease. That tends to be. I mean, there are exceptions to the rule, and dads do a great job. But and there are some dads that are the main carers as well. So
that's right.
Shout out to them as well. But majority of the time, it is the mothers that are the ones that are the main caregivers, which we know.
And that has there's, I mean, by virtue of what we've talked about, we can safely say, though I don't know that's the right phrase, that the family is also potentially struggling with the pressures of the situation, their own mental health, their own physical well-being, as well as we just mentioned, financial well-being as well. So that needs to be just hooked in there as well too. And it is interesting across all these conversations we have, the disease or the illness, the health condition, the situation they're all different, but the lived experience has so many similarities that, our data collection through these conversations hopefully over time is going to point to that. You know, these are the things across all chronic conditions from a life perspective that come through.
Mm,
And then there's the medical differences. You
yeah.
know, it's
And I
just
suppose the big challenge for kidney disease is that most schools won't have experience with it.
mm,
So when you do come across a child with kidney failure and on dialysis or transplant, it might be the first time your school's ever seen it.
that's
And
right.
there isn't a nice little checklist or form or that you can fill in that will capture the individual child's
Mm.
needs. So, and it is individual for every child. So every child's a little bit different. It's
Yes,
not
it's
like that.
personal as
There's
well.
no asthma care plan or anaphylaxis plan or something that you can just pop into place. So,
Yes.
it's making sure that you're getting all your health professionals that are involved in that child's care to coordinate with the school and talk to the
Mm.
school. When I was at the Women's and Children's Hospital in Adelaide, a lot of my time was spent going out to schools and helping kids basically start school or
Yeah.
transition back into school or teach the people about what dialysis was. And so there
Yeah, I
are
wondered if you'd been an
resources.
outreach nurse as well.
Yeah,
So yeah.
so there's lots of resources that schools and families can draw on. So the families can talk to their renal team or their healthcare professionals and say, "Can you come and help me navigate school?" And there are people that are willing to advocate for you and your child as well, and let the school know what. And then for the school, answer their
Mm.
questions about because there's a lot of fear around, especially transplanted kids. We find that even going on school camp is pretty much impossible for kids on
Mm.
dialysis.
Mm.
No one will
Mm.
take them on school camp. They're too much of
Yeah.
a risk.
Yeah.
Um,
Yeah. No, I believe it. And we hear
and
that from
then,
others too. It's
yeah,
yeah, what
medications and all those sort of things. So medications at school, and we
mm,
know how the process around that is quite complex.
yes.
So if they've got 4 or 5 medications that need to be taken while they're at school during the
Mm,
day,
mm,
how is that managed? So link into your healthcare professionals. There are lots of supports out there that can help you to to
yes.
um, to help with those sort of things for both
Yeah.
schools and the families.
Yeah, and we'll give a shout out to a moment just of where you can head as well at the back
Mm,
end of this conversation. But though that wrap up on um, other school quality of life matters. You've
mm,
really, beautifully stitched that in there to uh, help us to. It was a great wrap up. It just helped us to understand how important it is and asking for help and knowing that help is out there. And
yeah.
we hope that our conversations like this one, we've got some great things planned to address some of those things that we've mentioned there and
Mm,
systematize the way schools can get information and support, for example, on kidney disease as quickly as
mm,
possible through our National Insights for Education directory, where we'll have your organisation listed and
mm,
also, capture the data that we've talked about today and put that there. It's that starting point to get people to that that important place that you've mentioned to get the help at the time that it's needed. So coming to the end, what's your call to action for kidney disease in 7 words or less?
yeah. Oh, it's really hard. This is really hard. But don't be afraid of their medical needs, of a kid's medical needs when
Mm,
they've got kidney disease. Don't be afraid. Try and find ways to work around them.
mm,
There's
yeah,
always a way to work around things. And always ask the family what you can best do to support them and their
yeah,
child,
I
not
love
just the
it.
child, but also the family.
I love that. And it really was a great bookend to what you said at the beginning, which is
Mm,
um, ask the kids what they want, ask the kids what
yeah,
they'd like to do, and what is going to give them the most everyday experience of life that they can have doing the things that they enjoy. Um, and so that requires being unafraid of, finding
yeah,
finding the solution at the moment, and not being afraid to, to move to that, and rather than stay in limbo and be just worried about it.
yeah.
Um, so at this point, we're at the end of the call, which has been an absolutely fascinating and inspiring conversation, and informative, so informative. So much gratitude to you, Roxanne, for joining us today, and thank you for making time to have this important conversation so we can get the word out there, and also the health literacy out there as well, because you have that incredible experience that you can bring to bear and translate what I guess is sometimes a very complex setting into everyday language that we can all understand. A big shout out to Kidney Health Australia, and you can head there for information, resources, support. So that's kidney, kidney.org.au. So thank you for joining me today, Roxanne, on Live and Learn. We are incredibly grateful.
No problems. And don't forget, everyone out there, to check your kidneys if you're at risk.
Love your kidneys. Yes.
Love your kidneys. Look after your kidneys and get them checked if you think there's something not right, or just do a test anyway.
Yeah, that's perfect. Perfect point to close out on. Thanks everyone for tuning in. Help us turn up the volume so all kids are seen and heard. Follow along, like, share, comment, or leave us a review, because we love hearing from you. And if you want to donate, head to missingschool.org.au, because every dollar makes a difference.